Hi dear doctors, welcome to the class of Kids Covering. Myself Dr. Parv and you are studying Pediatrics with me. The topic of discussion for today is hydrocephalus. So I hope you all know that hydrocephalus means there is excessive amount of cerebrospinal fluids within the ventricles or in the subarachnoid space, because you know that CSF is getting produced in the ventricles and then it is going to travel into the subarachnoid space. So please understand that hydrocephalus is something which is associated with increase in the intracranial pressure. Now, hydrocephalus is of two types. One is called as non-communicating hydrocephalus, that is called as obstructive hydrocephalus, and the other thing which is called as communicating hydrocephalus. Now, what is the difference between the two? See, non-communicating hydrocephalus is also called as obstructive hydrocephalus. That means from your ventricles, you are supposed to send it into the subarachnoid space, but if there is any obstruction, that is going to cause an increase in the amount of CSF in the ventricles, and that is why this is called as obstructive hydrocephalus. So there will be obstruction to CSF outflow. It can be in the aqueduct of the sylvius, it can be in the fourth ventricle outlet like foramen of Lashka and foramen of Magandy. Now, for the explanation, please understand that CSF produced in the ventricles cannot pass into the subarachnoid space, and that is going to accumulate inside the ventricles. But whereas what happens in communicating, see, once it enters into the subarachnoid space, you have got something which is called as arachnoid villi. So the CSF is going to get absorbed in the arachnoid villi. CSF is going to get absorbed in the arachnoid villi. So now, since the CSF is not getting absorbed in the arachnoid villi, of course the CSF, can very well flow in the ventricles, but since it is not getting absorbed, there will be increase in amount in the ventricles, and that causes hydrocephalus. So coming on to this picture can be asked in your exam. Now please understand, can you see here, these are the ventricles. So how to identify these are ventricles? See, if the bone is white, okay, this bone is white, of course the less dense, non-dense material, just like water, is going to be CSF. So these are ventricles, these black one, and can you see these are enlarged as compared to this? So basically this is nothing but hydrocephalus. Now what are the different causes of hydrocephalus? So please understand, there are something which is called as CNS malformations. 2-3 examples are there. I'll give you in the end of the class. Then you have got something called as infection. Now all the infections will have inflammation, and once there is inflammation, there will be accumulation of inflammatory fluid. These fluid ultimately is going to add on to the CSF and is going to increase the amount of CSF, or otherwise also responsible for increasing in the intracranial pressure. That's why responsible for causing hydrocephalus. Coming on to the next one, intraventricular hemorrhage. Of course, all the hemorrhages are responsible for increase in CSF. Then you have got some genetic defects, trauma, and teratogens. So please remember, the mnemonic is COIN, C for congenital, that means genetic issues and malformations, O for obstruction, I is infection, N for neoplasm. Yes, of course, some of the cranial tumors are also responsible for obstructing the pathway of the ventricles, and that is why responsible for causing increase in the intraventricular pressure, and that is why responsible for causing the hydrocephalus. And of course, there are some systemic conditions which are associated with it, and you very well know that in alphabets S and T come together. So S is systemic condition, T is trauma, as well as teratogens. Now, infants with hydrocephalus. Now, you must have seen some infants with hydrocephalus. So how do they present? They will have bulging fontanelles. They will have dilated scalp veins which are going to be there. And one more important thing is that they have got increase in the head size. Can you see the head size is increased? So increase head size, bulging fontanelle. So if you will press it here, you will have the bulging fontanelle, and of course dilated scalp vein is going to be there. There's going to be lethargy. Now why there is lethargy? See, because of increase in the intracranial pressure, there is decrease in the cerebral perfusion, and since the cerebral perfusion is less, it is responsible for causing brain hypoxia. Coming on to why there is vomiting. Increase in intracranial pressure is going to stimulate area postrema, and that is responsible for causing nausea and vomiting. Irritability, see, increase in ICP is responsible for pain sensitive. There are some structures which are pain sensitive. So whenever there is increase in intracranial pressure, they are the structures which are pain sensitive, just like meninges, Okay, meninges stretching is also going to stimulate the pain that leads to headache, and because of headache, the child is irritable. Coming on to diplopia, it is very common finding that in hydrocephalus, there is compression of sixth nerve. That means LR6-SO4. So LR6, that means the sixth nerve is not functioning. So lateral rectus is not going to function, and that is why there is going to be horizontal diplopia. There is papilledema also. Now, why there is going to be papilledema? Please remember, increased intracranial pressure causes increase in the pressure at the optic nerve, pressure at the optic disc, that is responsible for causing venous congestion, and there will be papilledema which is going to be there. Okay, right? So just remember my name, and you can add the PhD degree with my name, so easily you can remember. So P for PhD. So what is PhD? Papilledema, diplopia, headache. Then uske baad PVL. Okay, so PVL. Okay. Coming on to diagnosis. So please remember there are three modalities. One is going to be ultrasound, then CT scan, and then lumbar puncture. So ultrasound is done in the case of newborn children. CT scan can be done in children, who are, CT scan is a good modality. So, but the problem is, the issue is going to be with the radiation exposure. Okay. The issue is going to be what? Issue is going to be the radiation exposure. When to do lumbar puncture? See, if you are having hydrocephalus plus fever, now fever is something which is a good important sign of infection. So if you are suspecting infections, of course lumbar puncture is going to be a very good idea. And what is going to be the treatment? See, the problem with hydrocephalus is increase in amount of fluids. So in order to decrease the fluid, we have to give what? We have to give diuretics. Okay, we have to give what? Diuretics. So acetazolamide, furosemide, these are given, and of course surgical shunting is done. Now shunting means connecting one part with the another. So what you do, you create a VP shunt. Now what is VP shunt? V is ventricular, P is peritoneal. So from the ventricles of the brain, we are going to create a pathway to the peritoneum of the abdomen, so that excessive fluid which is entrapped in the ventricles can easily pass into the abdomen. Coming on to the complications, please remember that hydrocephalus can cause epilepsy, can cause infection, can cause mortality before 3 years. So infections and epilepsy. So epilepsy is something which is very commonly seen with hydrocephalus, so something which you have to understand very well. Okay, so this is it, and this is your homework. So what you have to do, you have to just open any of the textbook of your pediatrics what you are reading, and just let me know in one sentences each, like what is Arnold-Chiari malformation 1, 2, and what is Dandy-Walker syndrome. So this is it for this lecture. Thank you so much for joining, and God bless you.